2014 with the theme on therapy. My name is Dr. Johari Talib and I am the moderator of this session. Title of the workshop is Adolescence and Sexuality. Will be conducted by Professor Dato Dr. Saat Baki. Professor Dr. Mohd Baki is a clinical and counseling psychologist. He heads the Psychometric Center in UNICEF or University Selangor. He was the director of the Psychological Services Unit of Malaysia's Public Service.
Need to listen louder.
Hold on. You hear me? You hear me? Okay. All right. Good afternoon. Okay? Okay. Welcome to the second workshop of ISAM 2014 with the theme on therapy. My name is Dr. Johari Talib and I am the moderator for this session. Title of workshop, Adolescence and Sexuality, will be conducted by Professor Dato Dr. Saat Baki. Professor Dato Dr. Saat bin Baki is a clinical and counseling psychologist. He heads the Psychometric Center in UNICEF or University Selangor. He was the director of the Psychological Services Unit of Malaysia's Public Service Department. He obtained a Bachelor of Psychology in 1972 and Master's in Social Works in 1975. From the University of Western Australia and PhD in Clinical Psychology, 1982, from the United States International University, San Diego, California. He was a consultant for TNB, Petronas, IKIM, Maltrade, Prison Department, Permata, Royal Malaysian Police, Yadim, YPKT, and other organizations. Without further ado, I would like to invite Professor Dato Dr. Saat Baki to conduct the workshop. Dato, please.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Saya tak pasti sama ada saya kena berdiri atau duduk. So, mana yang lebih selesa, berdiri atau duduk? Berdiri. Kalau pasal apa, saya tak berapa suka pakai benda gadget-gadget ni. Jadi saya minta salah seorang datang tolonglah. Satu yang moderator terlupa cakap saya ni pakar seks. Jadi saya seksologist. Dan itu sebab dia orang bagi saya topik yang macam ni. Kalau tidak dia tak bagilah topik this time topik. Because my area of specialty is human sexuality and I did a lot of work in this area. But when I started working in human sexuality, I had a lot of flakes from everybody, including I was associated with the devil when I was working in this area. So today I'm not the devil. Today I'm trying to talk to you about sexuality among autistic adolescents. So what do we talk about? Why we want to know about this? Okay, firstly, when we talk about sexuality, we have to talk about normal sexuality and abnormal sexuality. What is normal is what I do. What is abnormal is what you do. So that's the easiest definition of it. Okay, so when we talk sexuality in adolescence, we have to talk about three different phases. The first one, we talk about pre-adolescence. Okay, I have people to walk around. I don't like to be in one position. So can we have the first slide, please?
Okay. This one?
I don't know. Where's the topic? So saya cakap autistic. That could be the one.
Kelon.
Now you can see my face. Just now you couldn't see because it's too far, and we have two sections and divided by the pillars. So we have the right side and the right side. So you need to move around.
Yeah.
Okay. So let's see the first slide. What is the next one?
You can control from there.
Control over here. Okay, yang mana satu?
Yeah.
Yang mana nak atas, mana nak bawah?
Sorry. It's okay.
Okay, don't change your station. It's technical problem. Okay, okay. So which one?
I will try and nanti
Ah,
saya
okay.
bagi kemudian.
He's going to try first. So as I said earlier, sexuality among adolescents is divided into three phases. We have the pre-adolescence, that's between the age of 11 to 30s. Then we have the middle adolescent. Today is everything will goes wrong. It started with her son, everything will go wrong. Hopefully I can arrive home on time. Okay, it's okay now. So we had the first phase, pre-adolescent. The second phase, adolescent stage, and the third one is the late adolescent. So as you see there, your child's autism is not getting worse, it's just becoming a teenager. This is very important because a lot of parents and public worried when the child reaches puberty.
Pointer.
Okay. You have to, now my daughter or my son's puberty, what is he going to do? Because sometimes it's embarrassing, actually for boys, when he walk around, suddenly he has an erection. He was in the middle of turning street and he had an erection. What are you going to do? How to cool it down? Which pillar you need to hide in order to cool it down? And this is some of the skill that we need. And for most parents, it is an embarrassment. While this is a natural process. It is natural for a teenager to have that kind of situation. But for people looking at him, something's wrong with him. As if you as an adult don't have erection. Okay? So that's the first thing that we need to be sensitive about. Now why is it missing? Somebody up there doesn't like me. Okay? So, with regard to the first part, pre-adolescent and puberty, the most important issue here is in terms of good experience within the family situation. Lack of positive experience can lead to poor self-concept. Now, we know autistic child is already have some difficulties. Now, coupled with the sexuality, it makes it worse. Number two, peers are relating the onset of puberty. Now, you have an autistic girl, she's just reaching puberty, suddenly she felt very hot today, so she just take out her shirt in front of everybody. What are you going to do? What are you going to do? Tengok shape dia ke? What are you going to do? So some mothers will carry extra blanket along. You cepat-cepat tutup. Okay, what does it teach the child? That her sexuality cannot be shown? Or does it mean that there are places, right place to do it? So the issue now, public exposure. Okay, remember, they have no information. Most of them don't feel malu, don't be shy, so they just do it. So our relationship to that is to minimize it, so that you don't feel embarrassed. Okay. The next area in terms of early adolescence. One of the things that the child will do is testing the limit. What can she do, or he does, in terms of his own sexuality? For example, he decided at that time he wants to masturbate. So you have all your relatives coming into the room, he just sit there and he just open his chest, start doing it. He plays his private part, which is okay. But in public? So what do you do next? How many of you, as parents, accept masturbation is a way of release? Is it okay or not okay to masturbate? Okay, studies have shown 90% of men masturbate, 10% of them lies about it. And 65% of girls masturbate. So masturbation is a private practice that you need to do in your own time, in your own place. But he or she decided at that time he wants to do it. So what is the strategy for you to pull him aside, to let him somewhere else, so that he can carry on his work? Or you said, this is wrong, haram, it's sinful to do it, and punish him, hitting his hand. Or worse still, you handcuff him. Okay? So I'm provoking your thought now. Okay, we are testing the limit in terms of social values, in terms of religious value. Okay, ordinary person must be, ordinary adolescent must be in his room. Would that be okay with you? Is it okay? After all, he's not borrowing your hand. He's using his. So why our attitude toward autism is different? In fact, it's just a normal, natural process of being adolescent. So always make adolescent sexuality, actually, is this autistic child, as something bad, something wrong, as if they have no sexuality. Okay? The next slide. Okay. Position statement. Autistic persons of all ages show an interest in sexuality and relationships. You ask them, you want to have a girlfriend? Of course he wants to have a girlfriend, but he doesn't know how. And he doesn't know the appropriate behavior of courting. He wants to touch you, to show friendship, but he touches the wrong place. Okay? A boy wants to be a friend to a girl, we put our hand behind her or on her hair, but just put on the breast. Suddenly your mother or your relatives come to the house and say, hello, auntie, how are you? What are you going to do? Okay, these are the realities that we are facing. Now, you may teach him many, many times, he still doesn't learn it. So are you going to say that everybody, when my friends come to the house, you should be locked because you don't know how to behave? Okay? The next one, poor social communication skill. Balik, tunggu dia. Poor social communication skills hinder these experiences. Because they do not have the skill to relate. They are not good in relating to other people. They don't know where the limit is, where the boundaries are. So they just do. And because of this, we have the tendency to block them from the relationship, so they have a limited experience. The lesser the experience they have, the worse they become. So does it mean that we must expose them to everything? Where's our limit now? Where's our boundary? Next one. Okay, the implication of this, they engage in few social behavior. Most of the time they have their own, a lot of repetitive behavior, the standard autistic child's characteristic. They have less sexual education. The question is, what do you teach them? No, we don't even have sex education for normal children. What more for autistic children? They have been fighting this battle for the last 15 years, how to teach sex education in school. We got into trouble, okay? Because when we talk about sex education, they say, oh, you are teaching them how to have sexual intercourse. I said, no, bullshit. Sexual education is teaching children the science of life and the art of living. How to live with a man and woman, how to get along with each other, how to get better in the relationship, and not fucking. Okay, this is our problem. And then we use certain words. Some of your faces changes when I use the F word. Merah, kuning, biru, dan jingga. And the colors of the rainbow reflected on your face because it is embarrassing to use it. And we use it all the time. Why can't we use it? Or not nice socially. In private, you can say all those dirty words. Sex is not dirty word anyway. It is good word to use. If the right place, with the right person. Oh, 10 minutes lagi. That's good. So just the beginning. Okay? Concern about future sexual functioning, both parents and children. Some parents say, what happened to my daughter when she's 17, 18, 20, 21? Will my daughter's life forever being a single person? Because she's autistic? Who's going to take care of her? If I die? This standard question among parents, SOP, when I die, who's going to take care of them? Now let's marry them. Then who wants them? So this is the mind. Limited knowledge about privacy and public sexualized behavior. This is one of the embarrassing situations, as I said earlier. Sometimes you cannot expose them, and sometimes they expose themselves. Okay, a few of them enjoy standing in front of the door and doing it. This was called a flash, like kind of flasher thing. But the flasher will show, here they're just doing it, and happily doing it in their own world. Okay, I have a situation. I don't know how many of you agree with this. I want to provoke you one more. The mother helped the son to masturbate. Boleh tak? Now he's doing it, maybe he's not doing it the right way. So you have to teach him the right way. Meaning, use proper oil, whatever it is lah that you want to use. And you can buy from the shop. Pharmacy will sell you what flavor you want. All the flavors you can have, and you can just buy it. Okay, will you do that? Because he's using his hand, it's very rough. Okay, it may cause some problem. But you think, okay, you want to do it, this is the lubrication, this is best for you, it's water-based. Is it possible? Is it possible for you to do that? Is it okay for you to do that? What's your position? What's your position statement regarding this? So father does it, okay. Mother does it, not also okay. Okay, my question is, which is, people say that's a very rude question to ask. What's it got to do with religion? What's it got to do with it? Here, a child under stress, they need to be relieved. And your function is helping him to relieve himself. Is it that wrong? Okay, these are some the process that we go through. So actually, as a therapist, this I need to go through. When I talk to parents about sexuality, these are some of the questions I have to ask them and to ask their opinion about it before I start treating them. Because I may do something against their cultural values. Okay? For some parents, masturbation is not okay. My son must refrain from all activities of touching himself. So when he goes to shower, put his hand up there. Okay, next please. Okay, these are definition of autism. I'm not going to read it. All of you are very well versed in it. Okay, next please. Social deficit, appear distant. These are standard textbook. You can open any textbook, you can find this. Okay, I want to focus on the sexuality. Let's go on. Okay, next one. Next one, we'll go faster. Okay. Lack of knowledge and raise anxiety level. So this means that autistic children and autistic parents of autistic children not knowledgeable about sexuality. Okay, that's the first one. And sometimes we are quite embarrassed to ask. And sometimes you ask, even the professional don't know what. Okay, so I'm sure as an organization, world organization, should have all these materials, how to help parents teach sexuality to their children. Okay, and I think it's very important to have this kind of guideline, or curriculum-based. What to teach, what does an adolescent mean, what are the sexual response cycle, from desire, orgasm, arousal, and all those various levels of sexuality. You need to teach them. Or maybe you teach yourself first before you teach them. Because some parents, when I ask them, one lady said, one of the things that you do, you have to masturbate the child. What is masturbation? She asked me, what is masturbation? I said, I don't know. You ask somebody else. I don't know about this. Okay? Some of the word, because Malaysia, we are very rich in terms of languages. Now, the last time I did a study in Sarawak, what are the same is the same term with the word penis. We come up with 88 different terms. This Sabah and Sarawak tak termasuk Kelantan dan Terengganu. Okay? Because each group has different term. So I had one patient come to see me, they said, doctor, my John has problem. I said, what? My John? I said, what John? I don't know that his penis is called John. So I said, oh, your John has problem, so let me help your John. Okay? In Terengganu, they call it awang. Ada awang kat sini. Okay, be careful. Okay, lower level overt sexual behavior, meaning that the normal courting behavior, the touching, is not there. Okay? And they don't know which part to touch. Okay, now you go and play basketball, you win the game. And you suddenly you feel very happy, you want to put a pad in your friend. Which part of the body you pat? The shoulder or the buttock? Now, this is very important because in our culture, it's inappropriate to hit the buttock. It is okay to hit the back because that's considered sexual harassment. Okay? Dah cukup? Cukup masa? Oh, I had 10 minutes. Tadi 10 minutes, now still 10 minutes. So the time doesn't change. You can fix forever. Just like a lady's age, she's always 35. No matter how old she is, she's 25. Okay? may display incorrect or inappropriate knowledge about social sexuality. Okay, I have one of them, one of my patients. They like to see women in pants. Okay, because when come to you, he just do this, and direct there, he goes everywhere. Now, what are you going to do with the finger? Now, he comes to a hospital, okay? So we have a lot of patients, and that's what he does. So what will you do? Do you tie his hand? Okay, because this is a very wide topic. I will not be able to cover in 20 minutes, because I'm supposed to be here 20 minutes, and I'm supposed to leave before 3, so I have 3 more minutes. With all the bullshit, so it's still away a few minutes already. Okay, would benefit from sex education one in terms of sexual physical response. What happened to your body when you are responding sexually? Okay, we have one case whereby she was not explained about menses. So she had a period. So she called, Papa, I'm leaking. So what should I do? If I leak continuously, I will die. I need a plaster to stop it. Okay? Now we don't tell her, if we don't tell her about what it is, she doesn't know it, and she got so frightened, start running around. But the problem is, why does she tell the papa, not the mama? Like our lady friend says, the father with the son, okay, so the daughter should be with the mother lah, kan? Now the daughter goes to the father, not the mother. Why is that? Who should do it? The mother for the girl, the father for the son. Is it true? Or is it possible to do cross-gender? Appropriateness of sexual behavior. What is appropriate to be displayed in public? Kissing, touching, caressing, fondling. Which one are okay, which are not so okay? Again, we have to look at our social cultural system. What's allowed within the culture? Huh? Okay, next slide, please. That will be the last slide. Failure to understand certain meanings of words. This is important. There was a great case. The lawyer asked me, now, if I touch her hair and caressing her, does she know that I love her? Okay, what's your answer? Does she know? Because the next question he asked, if I slap her, does she know that I'm angry at her? The answer should be no, for both. Because this was a rape case. Okay? Next slide, please. Tengok apa dia. I just talked about parental concern. Sexual behavior outcome, for example, sexual abuse, that's what we are worried about. In terms of being abused by other people. Sometimes they go on their own, naive about sexuality. They don't know what sex is all about. They go, oh, that person put something inside. What thing inside? I don't know. Okay? The important thing is that all autistic children, this is my conclusion, all autistic children wants to know about sexuality. The levels is different depending on whether they are functioning or lower functioning, higher functioning. But whatever we need to protect them. To me, that's the most important thing. For girls, need to protect them from being abused and get pregnant. Okay? For boys, be careful about homosexuality. Okay? Because within our culture, we haven't accepted that yet. So you have case of sodomization among this age group, because they don't know what the other person wants, they just respond whether appropriately or not. Okay? So thank you for listening. I know it is short. I'm sorry I was not able to cover it. Ini orang kata mudin terjun. Kalau bidan terjun perempuan, kalau lelaki mudin. Ini jadi mudin terjun, we have to cut it short. Thank you very much.
Thank you very much, Professor Dato, for addressing this interesting subject on adolescence and sexuality. We now open to the floor for Q&A. 3 questions only. Okay, question 1.
Yeah, fine.
Hello. Hi, my name is Hani. I'm a lecturer from Smart Reader International College. One parent actually asked me, is it appropriate if we use the term let's say, penis or ejaculation and what's not. Because his boy asked him, Mom, what is sex? So the way she explained is, when the belly button meet the belly button, the baby happen. So what is it okay to say the term, or we just camouflage with any terms? Thank
Okay,
you.
I want to ask you, what is sex?
That's why I asked you, return back the question to you, because
No,
the answer will be
because-
belly button with the belly button.
Okay, you know it is wrong. You know it is damn wrong. So
Exactly.
how do you correct it?
As for me, because I deal with children with autism, so
Okay.
I choose to use social story. So basically,
Yeah, that's one way out.
yes. So we can.
So what
educate.
do you call that thing that jutting out?
So I'm not teaching about that. I just said about okay
What do you
touch,
call it?
not
What do
okay
you call
touch.
it? What do you call it?
Penis?
Okay, why not?
John and Awang.
No, the question is, we are so embarrassed using the basic term. Well, it is
Exactly.
the right term.
But then the boy is 10 years old. So is
what?
it okay? Is it okay, right?
So what?
Oh, okay. I just need the opinion so that I can fight with the parents. So
Okay.
not using the belly button with belly button.
So don't use my authority to justify your behavior.
Okay.
Okay, it's all right to use it. But sometimes in our dialect, we use different terms. So it doesn't have to be penis. It can be something else. Boto, kote, and all the list lah. So you want the list, you come to my room, I show you all the 88 different terms. It is okay. But there's certain word like persetubuhan. What word do you use? How many of you still know the word concake? No, concake is 1960s. Now people don't, I go to penjara, and then I bring my student, and then the business, oh saya concake dia. Sir, concake itu apa? Because in the year of 2014, that word is already eliminated from the dictionary. So they know. So a lot of prisoners have been in prison for the last 20, because I'm dealing with rapists and murderers. In our prison, we have three groups of people. We have the murderer on one side, the rapist the other side, the murder come rapist in the middle. And that one we have 3,000 of them. And they have been in jail for at least 20 to 30 years. There's a minimum period is 20 years. So they learned in 1960, they're talking about it now. All the words I use, none of my students understand. Because past their time. So use what is appropriate to that community. Okay? Kalau you di Terengganu, gunakan abang. I ask a man, zakat anda macam mana? Zakat tak tahu. Zakaria saya kenal lah. So what's wrong with this guy? Okay? Puan.
Hi. What's the best way to teach an autistic child about, like the topic that we're talking about? Because
What topic you are talking about?
Sorry, sexual.
Okay, say it.
Sex.
Okay. No, as an adult, we're so embarrassed able to talk about sex. Say it. So what I'm doing you desensitization. I want to desensitize you to the words. Okay, you come to my program, the first day that you come, I ask you, okay, give me 10 words that have the same meaning as vagina. And see how you react to that. And then I say, oh, what's the word for clitoris? Doktor tak pernah dengar apa. Benda tu apa? Okay. It is the best way is using macam tadi kan storytelling, picture book, it can be used to a certain extent. Sekarang ni we have a lot of mannequin and a lot of simulation things that we can buy and show them what it is. But not too much detail lah. Orang kata nak bersubuh, ambil zakar, masuk cucuk dalam. Tak boleh lah. Okay, you need to look at the levels of the child. But it is good to in Islam we talk about aurat. So we need to teach the concept of aurat first. Okay, which is permissible in Islam and not permissible. And we teach them entering the parents' room, what time they should enter, what time they cannot enter. There are 5 times in a day that children cannot enter parents' room. So we teach them that. Okay. So your question. Oh, we have 2 more. So only 1 question left, kan?
Professor,
Okay. For your sake, it's okay.
Professor, please decide, please.
Can I ask you regarding since you're a professor, then there's a sexual therapist in US and all these things. So in our country, in your faculty, your plan to train sexual therapists? Because parents in overseas, they engage sexual therapists to
I'm a sex therapist.
yeah, but I'm saying as not as like professor, but
Okay, we have a view.
They hire to the house.
We have younger generations that do it now.
That's
The
what
surrogate, we
I'm
don't have surrogate partners here in Malaysia. It's against our law. We can help them. We go to the house, train the parents to talk about sexuality to the children.
train the parents. There's more
Yeah,
higher
we train
professionals.
the parents more because they will teach the children more than we are. Because you can see me only once a week. That's only 1 hour.
I see.
But in terms of sex education per se,
No education.
it's more clinical in nature. That's what I do, rather than academic. Because academic problem, I got kicked out from the ministry because of this. This is some of the things that I fight for. Okay, lady, one. And then I will go to the other side.
Okay. Hi, my name is Rita. I'm from Autism Link Malaysia.
Okay.
Yeah, so I would like to ask you about, let's say if a student with autism and they cannot express when, especially when they're during puberty time, they cannot tell whether do I need to go pee or do I need to ejaculate. So that's why they keep asking for toilet. So how do you actually teach the student to
Okay.
discriminate, like when do I need to pee and when do I need to ejaculate
Okay.
and do a
Okay,
proper-
first thing you ask them, you have an erection or not?
Pardon?
Ask them, do you have an erection or not? Because that is the difference. When you want to urinate, the erection is not the same as when you want to masturbating to ejaculate. So that's
Okay.
one. And the other one, use dolls that have penis. The problem with us, all our dolls have no penis and no vagina.
Okay.
Okay, in my clinic, we have that. So dia kata, ya, boleh dong ada zakar, tengok zakar, ni zakar tau. Nak buat macam ni. We use it dah. So we use the dolls in itself to demonstrate. No, doll that have actual penis and vagina. Oh, yes. This is new. You don't know that the dolls have penis and vagina?
Okay.
Okay.
Yeah, but what if the student doesn't have that comprehension
Okay.
level to understand?
You need to
our
accompany them
expression?
first
Okay.
and show what it is and then tell them. Because better kalau parents sendiri buat rather than school teacher. Now actually if you are a young school teacher, they have a crush on you.
Yeah.
And they may actually do inappropriate thing to you. Okay, your safety comes first before them. I hope you have insured. Okay, let's go to the
Thank
other
you.
side.
Okay, Assalamualaikum, Professor.
Yeah.
So I'm from the Asperger group.
Okay, good. You are the
today
first one to ask questions.
Yeah, today just transition to adulthood, okay?
Okay.
That I happen to have a son that's 27 years old, Asperger. So I remember masa dia 16 years old tu, dia masa what happened tu bila berlaku puberty tu kan. So benda tu just keluar and then and he told me that dia itulah. So now
I don't know what this
okay.
itulah ni, saya tak faham.
No, dia tak masturbate. Benda tu masa berlaku puberty. So
Okay.
benda tu just dia mimpi dia
Oh, dia ada wet dreams.
Yes, and then the wet
air
dreams
mani
and then-
keluar.
Yes, air mani
Okay.
keluar. So now how I'm going to tell the other parents, that teenagers parents,
Uh-huh.
that how can they talk explain to the teenager, anak-anak yang mengalami macam ni. So apa cara yang patut sebenarnya? Adakah
Okay.
secara kita punya Islamic punya ways atau apa?
Okay, the most important thing tu, who is very close to the child, the mom or the dad? Okay, that's number one. Now, because the one that is effective in helping him, the one closest to him. So you need to identify that.
Yes.
Okay, now, in terms of wet dreams, so the child may have actually experienced it before you tell them. Usually we tell them too late. Like we teach people how to accept that after they have already have sex. Okay, we teach people about menopause and all the ladies all have menopause already. Okay, so we need to teach them, and then also we need to teach from Islamic perspective. Actually, mandi hadas. You need to teach them.
Yes.
Okay, now whether they understand or not, that's the second question. But teach them first. If possible, ritualize it. Make it more of a repetitive behavior, because they will learn from that. We just explain to it, masuk kiri, keluarkan, no processing. Okay, then kalau boleh, talk to his friend. You have already experienced it. So I have a child that kata, Papa, something coming out lah, Papa. Apa dia? Tak tahu lah, Papa. You ada wet dream? Itulah, Papa. And he runs away. So he got so embarrassed telling the father about it. Okay, this one, remain calm. That's the most important. Don't get agitated, things like that. You are not comfortable.
Yeah.
Sex has to be comfortable, including husband and wife. Okay, if not comfortable, change your husband. Okay, Puan nak tanya apa?
Okay, thank you.
Last one.
Yeah, I have a question regarding Asperger's. An adult, maybe an adult teenage girl, who basically, I would say, has quite normally developed emotions, but still in the special needs training,
Yeah.
has this need to always want to experience sex
Okay.
and wants to get married.
Okay.
And I think there appears to be a terrible confusion and problem within the child and the parent.
Okay.
Because the parents tend to be overprotective with her.
Okay. No, protective mean what?
Is there a place for them both to go for counseling?
Okay, you can come to Pantai Hospital. I mean Pantai. No. I charge you. Okay, what is important in terms of sexuality? Does this girl have high desire?
I think she does.
This is hypersexual that we may need, okay, this is very difficult for me to talk. She may need medication to reduce her sexual desire. Okay, that's one. Number two, we may need to teach her how to use the pill.
How to?
Use the pill, makan pill, or injection.
Okay.
Because you cannot prevent her from having sex, but you can prevent her from being pregnant. And you can prevent her from dumping the child. Okay, so you are doing smaller sin in order to cover the big sin. Okay, but how many of us are open enough to do that? Oh, dia kata, doktor, kalau saya bagi dia pil, dia akan lagi seksual. Tak bagi pun dia sudah pandai. Dia kata, doktor, saya kangkang je, doktor. So, when you talk to these people, you need to use colloquial, the way, the language they use. Then only they understand. Dia kata, persubuhan, dia tanya balik persubuhan tu apa. Dia tak tahu. Dia kata, paku, tekan, lanyak, dia tahu. Paku, tekan. Oh, you have to come to my class. I teach you all those. Paku, tekan, lanyak. Dia banyak cerita lah. Okay, thank you very much for asking me all these questions. Wish you again.
Thank you, everyone, for the question and feedbacks. On behalf of the organizing committee, I would like to thank Professor Dato Muhammad Saat bin Baki for sharing with us this wonderful topic. Thank you, Dato.